Bismillahirrahmanirrahim. This is Dr. Ghufran Babar from Kids Health Corner, and sorry for some delay. I was out of country. So today we will resume our videos, and today's video is on normal growth or short stature as well. So growth is a very important sign of well-beingness for a kid, and parents are always worried about the growth of their children and kids. Usually, the growth in the baby, it starts as a baby and you go all the way until the mid and late teen years until your growth is completed. So the baby, when it is delivered, comes into this world, has a specific set of height and genes that the baby has acquired from the family. And the baby's physical size depends on the factors inside the body of mom, which could be maternal illnesses, maternal nutrition, diabetes, high blood pressure, smoking, drug abuse, and then the placental factors, whether the placenta has been functioning adequately and giving good nutrition to the baby, and the infections that the baby gets infected by may also play a role. And based on that, the future height determinants will be determined for the baby, and genes are the most important part of it, that what part of the family genes we have acquired. So during the first 2 years of life, on an average at birth, the baby's length is 21 inches or close to 50 centimeters. And during the first year, the baby grows half of that, which is 25 centimeters or 12.5 inches approximately. During the second year of the life, the baby grows about 5.5 inches or 11 to 12 centimeters. Subsequently, the baby continues to grow, the child continues to grow at a rate of about 2 to 3 inches per year until they hit the puberty, when they have the pubertal growth spurt and they end up within the family height. So for growth monitoring, the growth charts are the single most important tool that will help in tracking the growth of a child. And in the absence of growth charts, it is very hard to diagnose growth disorders and to diagnose so many other conditions. So if you look at a normal growth chart, I've just driven it by hand. So in first year, most of the babies at birth are close to the 50th percentile, and then they continue to change their growth trajectories depending upon the family height. So in first 24 months, 2 to 3 years, the babies can go up, go down, or stay in the middle depending on the family heights. Subsequently, the children will grow along their line after age 2 years and will end up within the familial target height range. So for a family, the height can be calculated based on the maternal heights. So for example, for ease of calculation, I would say a child's mom is 5 feet and 5 inches, dad is 5 feet and 10 inches. So for boys, we add 5 inches to mom's height, who becomes 5'10", and dad is also 5'10", so their mean height would be 5'10". Considering that boys are about 5 inches taller than the females. For the girls, we subtract 5 inches from the dad's height. So if the dad is 5'10", he becomes 5'5", and mom is 5'5", so their mean height, adding maternal and paternal heights divided by 2, would be 5 feet and 5 inches. There is a genetic target height range, which is 2 inches along the mean. So a boy who is genetically 5'10" could be ending up between 5'6" to 6'2", which is the genetic target height range, which is 4 inches along the mean. So if the mean height is 5 feet and 10 inches, 4 inches above and 4 inches below would be the genetic target height range. Same as with the girls, if 5 feet 5 inches is the mean, so 4 inches on either side, 5 feet to 5'10" could be the genetic target height range. That is why you will see that some tall parents have short kids and some short parents may have some taller kids. Or if there are 7 or 8 siblings, some are in the middle, like they may be 5'10", some are 5'6", some may be 6 feet or even taller. So there is a phenomena which is called regression to the mean, which means that not all tall parents have tall kids and not all short parents have shorter children. So that on an average, the mean height for the population remains stable and does not appear to be a population of giants and dwarfs. So this is the phenomena that God has picked up for the normal growth of the population. So after age 2 years, kids keep on growing at a rate of about 2 inches, or the max is 3 inches per year, depending upon the familial genes. So in a growth chart, I always say that if the growth charts are not available, it's hard to understand the growth. So for parents, I would advise them that every time their child visits their physician, please check the height and weight and maintain your own growth charts at home if you cannot have them at your regular doctor's office, where you can plot their heights and weights. And today's world, you can get the growth charts online on the CDC website, and other sources could provide you with the growth charts. And those growth charts can be maintained longitudinally to assess the growth of your child. So for a familial short stature kid, the chart would be like this. The child is small and continues to remain small. And in this you can see that the parents are short, and from what I see is the dad is mom is 5 feet tall, dad is 5'5". We add 5 inches to mom's height, so she becomes 5'5". So the mean height is 5'5". So the child grows at the lower centiles between 3rd and 5th percentile and ends up, and he does not lose any centiles and grows along his isopleth in a straight line. So this is the typical growth chart for a child who has familial short stature. For average American males, the height is 5 feet 10 inches. For average American females, it is 5'4". In underdeveloped countries, it is shorter. Pakistan may not be more than 5'6" for males and 5'2" approximately for females. So the heights are a little different in underdeveloped countries and Pakistan. Same is with India and the South Asian countries. So this is the normal growth that indicates what is really going on with the child. I will do another video in which I will go through the growth disorders. How will growth affect different hormonal insufficiencies that will affect the short stature. So the different hormones which are involved in the growth are growth hormone, which is released under the influence of growth hormone releasing hormone from the hypothalamus, which affects on the pituitary cells, which make the growth hormone, that then goes into the liver, where it makes a hormone which is called IGF-1, that then goes and works at the long bones, at the growth plates, and we increase in height. And IGF-1 is also dependent on nutrition, so we'll rule out malnutrition and celiac disease in kids who have short stature. Thyroid is another hormone which is important for, so we check the free T for and TSH levels, we check the we check the CBC, making sure there's no chronic illness, we check the CRP, making sure their inflammatory markers are also normal. We also check a hand x-ray, which is the x-ray of their right hand, and look at the growth plates at the hands and compare with the growth plates of the same age or younger or older to see what is the hand x-ray growth plates like. And those growth plates assessment can give us an idea of predicted adult height. So these are some of the things which are done at baseline for any child who is referred to our clinic for assessment of short stature. And in my next video, I will go over different patterns of growth. I hope that you have understood the normal growth in children from today's video. Please share it with the other people and subscribe to my channel, and feel free to post any questions if you have. And thanks a lot. This is Dr. Gufran Barber from Kids Health Corner. Sallallahu alaihi wa alihi wasallam. Thank you guys. Have a good day. Thank you.